The World Health Organization says nearly 1 in 4 Ebola infections are going undetected in the Democratic Republic of Congo. The outbreak, which started last year, has left more than 1,300 people dead. It is the second worst outbreak of the virus on record after the epidemic in West Africa in 2014. Healthcare workers can't reach some areas because of violence, and in some cases, they are being attacked. CGTN's Ocamringa has more from Kinshasa.
Healthcare workers trying to prevent the spread of the Ebola virus in eastern DRC have been targeted by armed groups in Beni, Butembo, and Katwa. That has seriously disrupted their efforts to stop the disease from spreading. But the UN has now stepped up Ebola prevention work to the highest level of emergency response in a bid to bring a swift end to the outbreak.
They have decided to escalate the level of intervention to the highest level, the L3 in the UN system, meaning that we mobilize more resources and we'll have more, not only financial resources, but more capacity on ground to really address all the pillars.
The UN activates such a response whenever agencies are unable to meet the needs on the ground. The Level 3 response has only previously been applied in Yemen, Syria, and Mozambique. According to the DRC Ministry of Health, the Ebola outbreak has now surpassed 2,000 cases, with more than 1,300 people reported dead since August last year. International health experts have now scaled up their response. DRC citizens in Kinshasa say they welcome the UN's decision.
I'm very happy that the UN has stepped up the Ebola response.
We are very, very happy for that, but what we are regretting that every time, that is the 5th or 6th time that Ebola hits Congo Democratic. They can't find any solution once.
The current Ebola outbreak is the 10th to occur in the DRC. It's the second worst in the world after that seen in West Africa in 2014. Ocamringa, CGTN, Kinshasa, Democratic Republic of Congo.